You are watching Rooted and Rising, and this is a show about aging, healing, and everything in between. So let's get into it. At some point in time, you might be questioning whether it's time to seek out another doctor for your healthcare needs. Maybe you're feeling rushed when you go into the office. Maybe you feel like you're not being taken seriously when you see your doctor. Or maybe as you age, your healthcare needs have changed. All of these reasons and many more might be time to consider seeking out another medical health professional. Many people stay with their current doctors out of habit, loyalty, or just simply convenience. Healthcare should be a partnership between you and your doctor. So, if you ever left your appointments feeling confused, unheard, well, it might be time to consider seeking out someone else. Sometimes that feeling is a sign that it's time to make a change. So today, this video is going to talk about 10 reasons why you might consider changing your doctor. Number one is that you don't feel like you're being heard. Have you ever had some health concerns? You've maybe generated your questions that you want to ask your doctor. You go into the office well informed of some of the things you've looked into about your health history. You present it to your doctor and then they just kind of brush it off, not really hearing you out. Maybe you're feeling like your concerns aren't being addressed. You're feeling dismissed instead of listened to. This might be a red flag that it's time to seek out another doctor. Number two is that you feel rushed at every appointment. Granted, doctors are overwhelmed with a lot of patients. You should go into your appointments feeling like your concerns are being addressed, that you're listened to, and that your doctor is taking time to really think about and listen to what you're saying about what's happening to you and your body. If you're feeling rushed when you go into appointments, then oftentimes your concerns aren't being met. Further investigation, further tests, further information needed might be overlooked at that point in time because your doctor is simply rushing you through this appointment to get to the next one. This might be a sign that you need to seek out someone else who is able to listen to you and your current needs. Number three is poor communication. So you go into the doctor's office with your current concerns, and there just seems to be a disconnect between the communication. You share your concerns, and instead of being met with understanding and simple and clear dialogue from your doctor, you're bombarded with a bunch of medical jargon that you simply don't understand. You leave the office feeling more confused than when you came in. In addition to that, more doctors are using what we call patient portals. I like patient portals. It's a one-stop shop for pretty much everything medical. You can get your medical records there. You can see current lab results on those patient portals. You can also communicate back and forth with your doctor about your diagnosis and recommendations on what you need to do for your health. The trouble comes in where the doctor only uses that patient portal as a one-way street. So they communicate to you what they want you to know. You have questions and you get no response at all. Maybe you've made some requests on the patient portal and no one gets back to you. In addition to that, when you seek out live responses by just simply picking up the phone and making a phone call, messages are taken and no one returns your phone call. We should be able to go into our doctor's office and be able to communicate and have that communication returned to us. This is going to ensure better quality of care and that things go a lot more smoothly when we go and see the doctor. Number four is that your concerns aren't being addressed. I see this with some of my senior clients who have gone to the doctor with their current concerns, and instead of addressing those concerns, they're met with, well, it's just aging. You're just getting old. So yes, it could be a sign of just aging simply, or it can be other important matters that need to be looked at. This only delays further testing, further observation, and further communication about maybe some more serious matters that are going on with your body. So number five is that the office is always disorganized. Charts cannot be found, lab results cannot be found. Maybe you submitted some information on the portal or mailed the information in or faxed it in, and they just simply cannot find it. In addition to that, there's often long wait times. I've had to switch doctors because the wait times were simply too long. I had a doctor that I was working with for many, many years, very good doctor, but As time went on, she got more and more patients. This wait time just became just too much for me. I was there at times 2, 3 hours waiting. When I communicated that to the doctor, they tried their best to make changes, but it just didn't happen. And so I found that for me, it worked better to seek out someone else that was able to see me in a timely fashion. Number 6 is that your doctor simply isn't up to date. We see this sometimes with doctors that have been practicing medicine for well over 20, 25, 30 years. Very knowledgeable in what they do, but there's a lot of things going on. We know that the medical industry always is an ever-evolving, ever-changing process. Just things like digital systems come up where doctors are now communicating more on patient portals. There's medical care changes in how we're being treated that's now happening, and doctors just simply aren't aware of that. Instead, they just rely on kind of the old school tactics of what they've known all along, and current treatments just are simply ignored. In reality, doctors should stay current on any medical changes that are happening out there with regards to treatment and care of their patients. Number 7 is feeling judged and uncomfortable when you go in to see your doctor. A doctor's office should be a place where you should be able to share anything about your medical history or any concerns that you have without feeling judged. If you go in and you feel awkward about sharing information, this only delays the process of treatment. We all should go in feeling like it's okay to discuss any aspect of our health without feeling like our doctor is passing judgment on us or telling us what to do with our lives. It's a place to share information with us, educate us, and help us to take better care of our health. Number 8 is that they don't respect your preferences. So sometimes there's things going on us that require certain treatment, but at the same time, we might have a difference of opinion. Maybe there is a certain testing that needs to be done. Maybe the doctor wants to prescribe a certain medication, and just maybe we're not ready for that. The medical office should be a place to discuss that, discuss your concerns, without feeling like they're being dismissed. Our partnership should be collaborative, where I'm able to share my thoughts and feelings and concerns, and the doctor is able to share their professional opinion. There's a meeting of the minds met, and we can agree on what's the best course of treatment. Number 9 is that our insurance changes or the cost of care has changed. Our doctor maybe has to go up on their prices that they charge for treatment, or simply that our insurance provider has changed. If you're, say, a Medicare client and you are seeking out a new healthcare provider, it's a new enrollment period, then maybe you've switched providers and your doctor just not accept that current provider. Sometimes people will change companies that they work for, and with the company changes, there is insurance changes. And so with all of that, it might require us to seek out another medical professional that takes our insurance. And number 10 is that perhaps your healthcare needs have changed. As I mentioned earlier, we all are getting older, and as we get older, we might develop more healthcare needs along the way. We might require more specialized treatment. We might require more medication. There just might be simply more things going on with our bodies as we age that might require more care. Maybe our current doctors cannot manage that adequately, and it might be time to seek out more specialized service or a doctor that can manage our entire state of how our health is changing. Sometimes as we age, we just stay with our doctors out of convenience and loyalty, and it just might be time to make changes there. In fact, our doctors should understand that and even encourage us to seek out other providers who might provide more specialized care and maybe even help us with seeking out those specific providers. Taking care of yourself is one of the most important things you can do as you age. Advocating for yourself is a part of your responsibility. It's not a sign of disrespect. You deserve a doctor who listens, communicates clearly, and treats you like a partner in this collaborative journey of your health care. If you're feeling unsupported in this journey, it just might be time to seek out other options. Remember, the goal is not just to live longer, but to live better. Are you considering changing your current healthcare provider? Or maybe you're satisfied with the current care that you're receiving. If you have any questions or comments below about this topic, put them down below. I would love to hear about them. And until next time, I will talk to you later. Bye.